Hello, my name is Alexandra Johnson. I am a current third year medical student, part of the Charles R. Drew UCLA Medical Education Program. I worked with Dr. Shiva George at Drew, as well as Tricia Hanito Lopez, Director of Communications, as being part of the senior services for my project. I was lucky enough to do my year of service with St. Barnabas Senior Services, which is a nonprofit dedicated to helping older adults live and age with dignity for over 100 years. In my project with SBSS, I served an underserved population of older adults that was diverse in terms of ethnicity and nationality, as well as language, speaking a mix of English, Spanish, and Korean, some of whom had very low English proficiency. 90% of clients live below the poverty line, and many lack access to healthcare as well as social services. The older adults I worked with were hit the hardest in the pandemic due to social injustice as well as systemic factors. They're the most vulnerable in Los Angeles with the highest rates of COVID-19 and the lowest vaccination rates. How did I want to do my project? So I decided to do a communication and health education campaign using my skills as a medical student, using what I could offer. I updated their website. I made educational infographics, pamphlets, but ads in newspapers, even recorded some classes. I focused on making my content culturally competent and also catered to the needs and feedback of older adults, especially those who had few health resources during the pandemic. Some of the activities I got to do was coffee chats with Miguel, our social worker, and kind of supported older adults through their pandemic, answering their question, talking about vaccine hesitancy, walking them through the process of guidelines. It was one of my favorite things to do. I also did talks with the Virtual Senior Center, a national platform that allows older adults to log on and have educational info sessions about COVID and also talk to each other. I also hosted a discovery series with the Department of Public Health, communicating about COVID statistics, as well as communication tactics for other older adult serving community organizations, as well as the seniors that we served. I also got to do food delivery services and educate door to door, interact with seniors, and do weekly tabling sessions from January to February, um, and host events talking about the Omicron variant and new updates to the COVID profile. I got to measure my project in a few ways. We incentivized many clients to get vaccines through our dinner and a dose programs and tell a friend, which I made communication materials for and advertised. And clients were able to receive a $25 DoorDash gift card in exchange for getting vaccinated. I also made a 17-page COVID booklet that was printed in English, Spanish, and Korean and sent, handed out to over 5,000 people, which I'm pretty proud of. That went through everything from vaccine hesitancy to how to keep your neighbors safe. I also had positive feedback surveys from the virtual senior centers that I could respond to, kind of adapt material to. But most importantly, I think I measured my project in terms of my own unique perspective. As much as I did and during my year of fellowship, I feel like the seniors did so much more for me. Um, they are the ones who know how to make their communities safer and healthier. And they already have the voices to do so. I just try to help make those voices louder and provide information in these communities that were generally overlooked during this pandemic and beyond. I'm really grateful for this opportunity. I just wanted to show a few pictures from my year. Here is a talk with Discovery series where we talked about staying safe for the holidays, as well as our virtual senior center conference and a few community events that we volunteered with and talked to seniors through. Thank you so much for this opportunity.